as you might be knowing that the weather is not very good. Uh, we will be has sorting out some queries because we have received some queries. Uh,
Yeah.
there is this patient. I'll just read out the query first. Rinku Mani Pujari. She has written, good evening, ma'am. I want to ask Partha sir that our 8 years daughter was COVID positive with mild fever symptoms for days. Now she became negative. Question is that is there any post-COVID test or medical consultation required for her? She also has asked, uh, in COVID positive period, my daughter was also suffering from redness in eye for 2 days, but now it is okay. Now there is no any problem in her eyes. Will there be any problem in the future in this regard?
Yeah. Thank you, Rinkumani, for the question. Uh, First of all, uh, my blessings to your child that she is recovered now and she is doing well. I think see, for most of the children who have suffered from COVID this time, they have recovered and they have very unlikely that they should go into developing complications. But as we have discussed earlier, there's only one complication that is MISC, which we see in children with COVID, and there is time frame around by 3 months of age. There is always a risk. But whether there is any test to determine that, no. We don't have any test which will say that your child is going to develop complications or not. I don't think we need to be worried about that. We should be thankful that your child has recovered now. Just give her good hydration, good diet. Uh, Let her into her normal activities. Don't worry. I think she won't suffer from any complications. She'll be all right.
Okay, sir. Uh, just wanted to ask you one more thing, sir.
Regarding her eye problem that she asked, sorry.
Mhm.
See, this time most of the children with corona, we have seen conjunctivitis. Most likely, as we have discussed, the route of entry could be to the conjunctivitis as well. So, with children, there is conjunctivitis, but this conjunctivitis, as you have said, most of the children has recovered by around 4 to 5 days, and there's very unlikely that they'll go on to develop any complications in the later part of life.
Okay. And another thing, sir, when if a child has been seen with the symptoms of conjunctivitis, so is there any other symptoms also that would be prevailing during if it is a COVID positive case, or it is just the
With a
conjunctivitis?
child with the during the COVID time, with child with conjunctivitis, they mostly recover by 2 to 3 days. But along with conjunctivitis, there are other symptoms, like the child is suffering from high grade fever. There is 103 plus fever. This is a continuous fever. Every 4 to 6 hours, the child is getting fever. And child is irritable. Child is sick. The child is crying all the time. He has not been able to console her. Along with conjunctivitis, you see red rashes all over her body. Like if the child is complaining of anything, any redness or in the lips as well as in the redness of the tongue, there is swelling in the leg glands, of course that could be a sign of MISC. Or only conjunctivitis, we should not be worried. If there is association of other symptoms, then of course we need to be worried. We need to consult with the pediatrician immediately.
And sir, regarding an emergency, when there is an emergency, so is it possible that we will be finding the doctors available 24/7 with it when it's related to child emergency?
Most of the children where there is a COVID care center, they are tapping to the pediatric population as well. At Pratiksha in our hospital, we have a special we have kept beds for COVID patients, COVID children patients basically this time because we are getting a lot of cases and getting a lot of calls. Already we had around 3 to 4 children who were really sick, who needed proper care, and they have recovered, and two of them have already gone back home. One child with COVID pneumonia who was on ventilation. We've been able to take him out of the ventilator today. He's also doing well. So hopefully, all of them will not, the mortality will of course be very less. And sorry, if the child requires any kind of emergency care, most of the hospitals are well equipped to deal with the pediatric emergencies.
So
Yeah, the Bari also doing. In a Pratiksha also, we have a 24/7 pediatric emergency where we will be dealing with the patient as well.
So one more question we have got is like, say for example, a child has been hospitalized for COVID reasons. and how are the child is going to stay away from the parents? It's like because it becomes very difficult for them to stay away.
We are not, will not be able to separate the child from the parents. If it's a infant who is of course more than 6 months away, the child has to be along with the parents. So either the mother or the father will opt for, if the parents are positive, of course it's better. But if the parents are negative, the mother or the father will opt, and one of them will have to stay along with the parents. We have to allow the parents to stay with the child.
Okay, even if at the COVID wards for the children, the parents are allowed to stay with.
Taking the risk, they have to stay.
uh, because this is a very important question for the parents, because I having my own child, when we will be thinking about the all the precautionary measures and all the pros and cons, so we need to think whether a child would be able to stay alone or not, because it will become very difficult for them
It
to.
will be very difficult.
Anyway, sir, we have almost come to the end of this show. Thank you so much for giving us such an important input. So, what would you suggest the parents at the end regarding this entire situation? That is it really a state where we need to be panicking about it, or we need to think rationally and calm down and work properly? So, what do you suggest? What do you have for the parents?
Yeah. This is the most important thing. We need to be cautious rather than being panic. What we have seen from whatever we have learned from last year is that only three things have been helpful. It is the social distancing, the mask, and the sanitization. So we need to follow it religiously. This is the most important thing. And for parents, because they have to go out, they have to go to the market, they have to go to the office, they have to do their daily activity. So it is very important that you wear your mask carefully and properly. The most important thing. Most of the time, you see the mask hanging just below the nose or mask hanging on the throat. That should be avoided. Take it seriously. Wear your mask properly. Whenever you're coming from outside, wash your hands properly. Sanitize your hands. Take a bath and then play with the child. Your child will not get the infection unless and until you bring the disease. So it is important that we maintain the what is known as the SMS, social distancing, mask and sanitization. That has to be followed religiously. Other than that, of course, these are difficult times. Again, if anybody in the family is suffering, most of our pediatricians are taking up phone calls, and through phone calls, WhatsApp, whatever possible way we can do, we are trying to help you out. Whatever medicine that will be required over the phone, we are giving you prescription. So contact with your local pediatrician, your daily pediatrician, and then we'll always there to help you out. So don't panic. In case of any emergency, again the setup is there. I think the hospitals in and around Guwahati are well equipped to take up all the emergencies. So we'll be able to do it. So don't worry. Have faith and believe in yourself and follow the rule of SMS. And I think it is just a matter of time. It just maybe another 2 or 3 months, the incidence of the disease should come down. But again, we should not just be liberal as soon as the disease goes out. So we should always maintain this three things. I think for next 1 or 2 years, we have to follow these rules so that we can avoid the third phase. Otherwise, again, we might end up with the third phase, which many of the experts are already predicting.
So to avoid this third phase, is it safe for the children when the thing is subsiding slowly and things are slowly, hopefully, getting back to normal? Do you think taking out our children to parks or to some amusement places, will it be safe by then?
It's $1 million question you're asking. It's a very difficult question to answer whether we need to send them to the parks, to the schools, where to take them to the malls, where to the playground. It will be very difficult. It's a very difficult scenario now. Whatever, let's hope that the situation improves over time. And if the disease incidents come down, then children, if they can keep their masks on, they can, of course, go to the playground and play. But of course, again, we have to maintain the protocols that we need to follow during this COVID time.
So one last question before ending up is, like, we have often seen that I myself have seen in my toddler that after some point of time they feel very uncomfortable wearing the mask for a longer time. So how do we think we can help them to wear it? Because if it will it cause any breathing problems in the future for that?
See, it's not only toddlers, even adults is very difficult. If you're not used to wearing a mask and it's covering your mask, And after wearing a mask, it's even very difficult to talk with the talk also, because your whole facial muscles have all been cramped up. So anyway, for children that's why less than 2 years of age, it is really not advisable for me to make them wear masks. Children again, it is very difficult even for my own child. She doesn't want to wear a mask for a long time. If I ask her to keep her nose, keep the mask on her nose, she'll say, "I'm getting difficulty in breathing. I'll not be able to breathe as I." She'll make all those complaints. But even then, during traveling, whenever they go out, we need to make sure that they have at least the mask is there. It will take some time, but I think if you go look into Southeast Asian population, especially if you go to Vietnam, Hong Kong, or any other Southeast Asian countries, you see everybody is used to wearing this mask, and it is by wearing this mask only they have been able to avoid this catastrophe. So, and by over time, maybe we'll also get used to wearing this mask, and also we'll be wearing it anytime and everywhere.
So will
It
it
will
be
become one
necessary?
of our starting style also.
So will it be necessary for these children also to do double masking?
I think no, the double masking will be very difficult for children. A proper single mask is always sufficient for them.
Thank you so much, sir, for giving your time from your busy schedule. Uh, you have given us such important inputs, and I think every parent has these questions in their mind, which you have solved. If anybody out here who's watching us wants to get an appointment with Partha sir, they can directly take appointments from Pratiksha online, and they can also contact him at his WhatsApp number. If anybody is in need of that number, they can always give us a call. Our phone number is mentioned there at our page. I'll repeat it. It's 8638202951. So in case you need any help, uh, medical help, we will be there to help you and to connect you to Pathabora sir. Thank you so much, sir. Have a very
Thank you, Pinasi, and thank you to all the viewers.
good night, sir,
Thank you.
and wish you a
Good
very
night. Good night.
very good weekend.
Stay safe. Everybody take care. Stay safe.
Thank you,
Bye
sir.
bye.
Bye bye.